Welcome to my channel Brainies. Today we are going to discuss about the topic Weber syndrome. Let us just see this Weber syndrome briefly. What is Weber syndrome? Weber syndrome is a neurological condition caused by an injury to the uppermost part of the brainstem, that is the midbrain. It is usually caused by a stroke, infarction, but in rare cases it can also be caused by a brain tumor, a traumatic injury or infection. Weber syndrome affects the functions controlled by the small section of the eye movement. People with Weber syndrome can experience several major neurological problems. What does this Weber syndrome indicate? It usually indicates an injury to the left side or right side, or sometimes even both the sides of the midbrain. A stroke normally affects only one side, while an infection or injury can affect one or even both the sides. Patients with Weber syndrome usually have an interruption of blood flow to the right or left posterior cerebral artery, which is the main artery supplying the blood to the midbrain. This interruption can damage the third cranial nerve, which is a key motor nerve that helps to control the eye and the eyelid movement. That is the oculomotor nerve. Sometimes if a tiny branch, that is if a small branch of the posterior cerebral artery is interrupted, then the symptoms of the stroke which is caused by that could be milder and extensive than it would be if the whole cerebral artery, posterior cerebral artery, was interrupted. Normally only a branch of the artery will be interrupted in Weber syndrome strokes, though severity can vary. This Weber syndrome can cause sudden weakness and vision changes, usually blurred or double vision, and eyelid droopiness. Weakness in the muscles of the face, arms, and legs can also occur. In the case of a stroke, eye movement and eyelid function are affected on the side of the infarction, with weakness of the face, arm, and leg on the contralateral side, that is on the opposite side. For example, a left-sided stroke would affect the left eye and right face, left side eye and right side face, arm, and leg. Immediately after the stroke, symptoms may be at their worst because there may be swelling in and around the brainstem, which exacerbates the effect of the event. Any brain injury, whichever type it is a serious medical emergency and immediate utmost treatment is necessary. After initial care, which addresses the cause of the symptoms, most patients would experience some improvement over time, as gradually the swelling and inflammation in the brain vanishes or diminishes. Physical therapy aids in stimulating the recovery of the brain injury, which would be a key part of the treatment. Physiotherapy can also optimize the ability to move the muscles of the eye in addition to those elsewhere in the body, despite any lingering brain damage. Recovery can take weeks, months, or even years, depending upon the severity of the midbrain injury and depending upon the response to the treatment. That's it with Weber syndrome. Thanks for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again. Wish you all a happy and a prosperous New Year 2023.